Hello and welcome to this edition of FYI. I'm Elaine Chang-Baxter, the Director of Partnerships for Montgomery County Public Schools. With us in the studio today is Kevin Riley. Kevin is an MCPS school psychologist and the co-president of the Montgomery County School Psychologists Association. Thank you so much for joining us today.
Thank you for having me.
Can you tell us the role of school psychologists?
So school psychologists, we have a many varied role, and from day to day we might do different things. We study and we learn about psychology, but also about child development and education and how those two things interact. So on one day we might be helping a principal put in a whole school-wide program to help with a specific area of concern. We might help a teacher on a class or a set of group of students who they might have concerns about, but also we do individual type work where we might be doing an assessment with a student or just working in counseling one-on-one with a student. So we run the gambit in all of those areas, and so every day looks a little bit different.
Okay, and you guys are assigned schools? You're not necessarily based in certain schools, or maybe some?
So every school has an assigned school psychologist in it. Some of us are in 1, 2, or maybe assigned to 3 different schools. It varies across the county depending on the school's needs, but also what special education programs might be present in that school.
I see. Okay. I'm not so sure I know the difference between mental health and mental illness. And is there a difference?
So that's a great question. When we talk about mental health, we are thinking about all of the positive aspects of your mental well-being. So these might be activities that you engage in that give you support and feeling, that give you a sense of accomplishment, our relationships, our positive relationships, interacting with people. Whereas mental illness is when we think about when our feelings and our emotions, which we all feel to a certain extent, kind of get in the way of our functioning, or they get so intense that we're not able to cope with them adequately.
Okay. Are there prevalent mental health disorders in children that you guys are seeing in our school system, or children in general?
It's estimated that about 1 in 5 students will exhibit or experience a mental illness throughout their lifetime.
Wow.
So we find it's fairly prevalent, and we know that most kids that receive mental health services receive it within the school setting. Well,
that's good to know that we have that support system in our schools. What about, is there a difference between stress and anxiety? I kind of lump them in together.
So we definitely hear a lot about that our students are very stressed out, that there's a lot to deal with, especially even from as social media and all these things come up. It's really, really hard for students that there's a lot to deal with that maybe us as adults didn't necessarily experience depending on when we were in school. So we know that stress is a really big problem, and stress is something external to you. Stress is how you and then how do you respond to that using your coping skills. When we think about anxiety, anxiety is more of an internal feeling, and it's an internal feeling of fear. And again, we all experience anxiety to a certain extent. So we might be worried about a test the next day. But in that case, the anxiety or the stress could be productive in terms of we might study then in order to relieve ourselves from that anxiety and that stress. Whereas anxiety in an illness, and a mental illness becomes if the anxiety becomes too intense and it starts to impact our daily functioning. We also consider whether or not the anxiety is more generalized. So it's perfectly normal if you have something coming up that you're worried about, that you might be a little bit anxious about it, you might be thinking about it. But if you find yourself lying in bed at night and you're not quite sure what you're worried about, that can be a sign of a more severe anxiety illness.
Okay, so if it's a little bit more crippling in a sense.
Yes.
Okay, okay. And do you have any tips for students who are experiencing these emotions, or parents who are trying to support their children, or even staff?
So in terms of stress, it's great to just try to be proactive. And most of these skills we don't necessarily teach to kids directly, but for some students they might need support and help to develop these coping skills. But it can be things like staying organized. So if you know students have a lot to deal with on a day-to-day basis, so helping students develop the skills to plan and be organized, and if they need help on, say, academics, to seek help early before they feel like they become overwhelmed. but also in terms of setting goals, helping students set realistic goals, and talking about what do you need to do to achieve those goals. So that students aren't setting unrealistic expectations. We want also our students to achieve and to achieve to their maximum potential, but we also want students to understand the relationship between their work and achieving their goals. So those can be really great skills to help deal with anxiety, but also simple things like talking to your friends and decompressing and doing things that you enjoy can help relieve some of those anxiety feelings. They don't necessarily tackle the problem, but we all do it on a daily basis just to kind of help us when we need it. It can be really useful in terms of just having another person hear you and feel you. So I would just recommend, especially to kids, if your friends are talking, just be present and listen to your friends' needs. They don't necessarily need a solution to their problems. Sometimes it's just helpful to have someone hear and listen to you.
That's great, that comforting ear. What about depression? We hear about depression all the time. What is depression?
So just like anxiety, depression and sadness are all emotions that we all feel. Especially when it's in relationship to an event. So we might feel very, we might have experiences of depression or feelings of depression, especially after something like the death of a loved one or some other sort of traumatic event. And so all of those feelings in those cases would be considered pretty normal. When we look at depression, it's really about the intensity of those feelings, and then again, how does it impact our daily functioning? Does it get in the way of our ability to meet our obligations, and also do we show a significant change from before? So if all of a sudden, you know, you felt like earlier in the year you were feeling fine and you didn't notice difficulties doing those things, if all of a sudden, you know, over time you find it's harder to do things, you feel more tired, lethargic, if you feel like you, especially if you have a lost interest in things, or if you have a sense of hopelessness, so like, what is the point? Those are all really more concerning signs about a depression illness that you might want to seek support.
Sure. If I'm a student in a school right now and I'm feeling anxiety or stress or depression, and the school psychologist is assigned to my school but maybe not there daily, what advice do you have for me as a student in terms of I'm ready to share that something's going on? Who do I go to share that?
So you can always, of course, talk to your school psychologist, but it's really any adult or person that you feel comfortable sharing that with, especially initially. Sometimes those people might be able to refer you or help get you those supports from the mental health providers. Just like every school is assigned school psychologist, we work with the school counselors and even with teachers to help them understand that just talking with kids can sometimes be a really good support, and so that they know that they're being heard and that they are, and my advice to the adults talking to them is to take what kids say seriously, and to really listen to them and not just push off their concerns as being maybe not that significant. Right,
better to vet and make sure that it wasn't that significant versus not do anything at all.
Yes.
Versus encourage people to speak up.
And also I would say in terms of for helping kids, if they're looking for just strategies, could also include just thinking about your physical well-being. So that ties directly to your mental well-being. So being physically active, exercising, even though it's hard if you're having feelings of depression, just doing activities that you find enjoyment in. And that those can help kind of break that cycle of I'm feeling down, I'm feeling negative.
Sure.
And then finally, I would just mention, a lot of times when we're having feelings of depression, we might have negative thoughts and just challenging those thoughts. So if you find yourself thinking, why try, because I'll never accomplish something, trying to be like, well, what's the evidence for that? And thinking about, well, I do have these strengths, and going back to that goal setting again, how can I then set a goal to try something, and so I can evaluate more realistically, what did I accomplish versus what do I need to keep working on.
Okay, great. And do you have any kind of quick tips for a student that is thinking about self-harm or suicide, or parents? Are there resources we can direct parents and kids to? So
the biggest thing for students is, if you're having feelings and those thoughts, is to reach out for support, to ask for help, to find a trusted adult to talk to. everyone in MCPS, all the adults are trained on talking to kids in this manner. And one of the biggest things is, from the adult perspective, is just by talking about it, you'll never make self-harm or suicide more prevalent or more likely to occur. So from the adult side, not to be afraid to ask. Same goes for your peers. If you see your peers going through a lot of behavioral changes, or they voice these things to you, even though it might be hard, it's really important for peers to acknowledge what their friends are saying and say, I hear you, I hear this is a really hard time. Never agree that you are going to keep a secret or that you're not going to tell someone. You want to encourage your friend to seek support, but if they're hesitant or they're not willing to, you might need to go for your friend and tell someone what you've heard.
That's great. So we're out of time, but what we'll do is make sure that we link the show to some resources that we're aware of that parents can refer to or students can refer to support whatever is going on in their lives.
Okay.
Thank you so much for being on the show.
Thank you for having me.
Absolutely. I'm Elaine Chang-Baxter. I'm the Director of Partnerships. Join us next time on FYI.